Just imagine for a moment that you are a child who cannot and will not talk to anyone but their parents. A child who has teachers struggling to understand their questions in class, simply because they cannot communicate. A child who can't even ask to use the restroom or ask for food, two basic necessities needed to survive. Place yourself in the shoes of a child like this. Place yourself in the shoes of a child who faces significant amounts of anxiety, tension, and stress when only trying to talk to people on a day to day basis. Think about the detrimental effects that this could have on yourself, not only as a child, but later on in your future. How can you possibly ask for what you need, make new friends, or simply communicate with people like your loved ones? Some of us may have moments in time where we are paralyzed with fear, maybe in class discussions, interviews, or tests. But I want you all to visualize harboring this fear on an entirely different level. The child that I'm describing to you all today is a mere representation of the hundreds of children who are suffering from a rare anxiety disorder known as selective mutism. Selective mutism is a rare disorder in which people can only talk and interact with immediate family members, but will fail to do so in front of others. The disorder is typically seen in children between the ages of 2 and 5 and interferes with their ability to use social communication in their life. Now, because disorders like these are so rare to come by, I want you all to imagine having limited treatment options for your disorder and only having a small cluster of people that truly know and understand what you are going through. Selective mutism is just one of the many rare diseases and disorders that deserve to be in the spotlight. With more than 7,000 rare diseases and 1,200 rare disorders in the world today, rare diseases and disorders deserve more attention, research, and funding, and we can and should all join in to help out. Many questions need to be asked to understand why there's such little attention and research being done on these rare diseases and disorders. First of all, why is it that with all of the advancements in medicinal technology and improvements in healthcare, that we are still so behind in developing treatment options for these diseases? One key reason is the length and scrutiny involved in the FDA drug approval process. The drug company must first identify a target, which is typically a protein in the human body that can be impacted by a drug. After this, the company must identify a compound, which is typically the compound, which can both bind and impact the target. The compound and molecule must be optimized and studied based on its use in the body through its distribution and drug absorption rates. The next steps are preclinical and clinical trials, in which the drug and its formula are tested on animals and in human volunteers, and is often the most expensive and lengthiest parts of the process. FDA scientists will then examine the drug and its formula to either approve, deny, or delay the request. This process can take over 10 years, and what's scarier is that the average cost for developing and approving a drug can range from $314 million to $2.8 billion. However, the FDA approval process is only one limiting factor as to why treatment options for these rare diseases and disorders are so rare to come by. Limited funding, especially for these rare diseases, can contribute to this lack of treatment availability. Many of you who have researched something for an essay or maybe just for personal enjoyment will have probably realized by now that research takes time, effort, and resources that not many of us have. Many drug companies do not consider developing treatments for these disorders profitable, especially because funding research is extremely expensive for treatments that will only help a small number of people. Additionally, many scientists and governments themselves will allocate more money towards more commonly known diseases and disorders that will help more people and in return will get them more money back. Overall, drug developers and scientists do not want to invest in products for these rare diseases and disorders because of the small profit margins for such a lengthy and expensive process. Moving on to my next point, I can guarantee that most of us sitting here today did not even know what selective mutism was before my talk. So few of us even know about the thousands of different rare diseases that exist in the world, despite over 400 million people being affected by them. Each and every one of us can make a difference in the vast world of rare diseases and disorders, and there are several reasons to do so. For one, raising awareness can help improve the quality of life for patients with these issues. By acknowledging the disease and the symptoms associated with it, more and more people will get the help they need sooner. This will ensure that patients receive the most accurate diagnosis and the most effective treatment option available. We will also be able to limit the amounts of isolation and negativity that people with these issues face. Secondly, with more research on these diseases, we will be able to advance in the fields of science and technology. Research, in general, is essential for the development of new ideas and for the progression of society. And with more research on these rare diseases, the number of treatment options will increase, and the amount of time for diagnosis and drug approval will shorten. Also, studying rare diseases is vital in determining the cellular and molecular pathways associated with the growth of more commonly known diseases and disorders, leading to a larger impact on millions of people. Most rare diseases are simply severe forms of more commonly known diseases, so studying them will help improve society's quality of life as well. Further, studying rare diseases not only gives us insight into the more well-known diseases in the world, but also provides us with more information on our own individual genetic makeup. Around 80% of rare diseases are genetic in nature, and so studying them can help prevent these diseases and disorders from arising in future generations, as well as promoting health in individuals that are alive today. Now that you all know why raising awareness is so important, let me talk more about why I personally decided to advocate for these rare diseases. I had the opportunity to study and work with children who had the specific rare disorder I mentioned, selective mutism, and it has intrigued me and has made me curious as to why there is such little attention and research being done on these rare diseases and disorders. When studying this disorder, I primarily focused on what treatment options would work better than the only approved FDA treatment option, selective serotonin reuptake inhibitors. I worked with my research advisor to publish a paper to both raise awareness about the disorder and to introduce novel treatments into the discussion for clinicians and drug developers to look at. Rare diseases and disorders deserve more attention and research than what is currently given and provided, and it starts with more initiative and contributions from people like you. You may be thinking, what can people who may not have any relationship to or impact on the healthcare field do to raise awareness? There are several things one can do, including petitioning or advocating for certain drugs to be approved or removed. Some can even develop or research emerging tools and technologies to help fasten the process. And drug companies themselves can try to dedicate more time to sharing preclinical data with drug companies and the public to help allow for improved reproducibility and strengthen drugs in the future. More importantly, however, is that if you have a rare disease or disorder or know someone who does, do not let it define or consume you. Realize that this process takes time and that there are so many people out there to support you, including your personal doctors, family members, and friends. We all need to appreciate the hard work that scientists and researchers put in and understand that science and the whole healthcare field in general are things that take time to advance in. Ultimately, it is so important to recognize the difficulties that people with rare diseases and disorders go through. When you now picture yourself in the shoes of a kid with selective mutism, I want you all to imagine how much easier it would be if there were so much more people supporting you and acknowledging your fears, and if there were so many more treatment options there specifically catered to you, your needs, and your symptoms. You could be the change and bring the awareness needed for kids like these, simply by being there for others and advocating in whatever way you can. Whether it be helping one person or 1,000, every life matters. So we should give rare diseases and disorders the attention and research that they deserve. Thank you.